Hello and good day. Today we are going to discuss antifungal drugs, their classification, and the mechanisms of some common antifungal drugs. At the beginning, a little disclaimers that we need to make before starting the presentation. At the end of this class, we expect that the student should be able to classify the antifungal drugs and describe the mechanisms of action of some common antifungal drugs. In microbiology, you have read about different type of fungi. Till date, we know around 2 lakh species of fungi, but no need to panic. About 400 fungal species are known to cause disease in animals, and fewer are probably associated with human diseases, but they can cause significant morbidity and mortality. As you know, fungal infections may be simple, like you might have seen fungal infections in the skin or nails. On the other hand, fungal infections can be severe and life-threatening. Like in the recent times, we have heard about the black fungus or mucormycosis during the COVID-19 pandemic, and black fungus, which is or mucormycosis, which is associated with high mortality rate, that came to the newspapers very often. So we need to treat the fungal diseases. But while treating the fungal diseases, there is a challenge. When your enemy and the host cell both look similar, then your weapons get confused. So to differentiate the enemy from the host, your weapons need to be smart enough. Now fungi, they are eukaryotes. So this poses a difficulty as we need to differentiate these fungal eukaryotic cells from our eukaryotic cells. But thankfully, we have identified some important targets. For example, the differences in the biosynthesis of membrane sterols. As you know, that human plasma membrane has cholesterol. Similarly, in the fungal cell membrane, there is ergosterol. So this ergosterol can be an important target of many antifungal drugs. Next, some susceptible fungi have an ability to deaminate cytosine. We shall see more in the context of a drug called flucytosine, which can be converted to its active metabolite only by the susceptible fungal cells, but not by the human cells. Next, the fungus has a cell wall. The fungal cells, as they have a cell wall, the cell wall is not present in our cells. So this makes a clear, distinct target which can be attacked by our antifungal drugs. Having identified these important targets, let's have a look at the classification. So you can find a table in your textbook about different antifungal drugs. First, we have the broad groups like the antibiotics. Second, the antimetabolites. Third, we have important groups like Agiles, and next allylamines, and we have the miscellaneous topical agents. Now, antibiotics, as you had antibiotics acting against bacterial infections, here we have antibiotics which are used for fungal infections. So among the antibiotics, the subgroups include the polyins, amphotericin B, which again surfaced in the news very commonly, during this mucormycosis or black fungus, because amphotericin B was a treatment for this condition. So I think many of us already know about this drug, at least heard its name. So amphotericin B is a polyen. In this group, we have other drugs like nystatin. The second subgroup is the heterocyclic benzofuran, for example, Glycophalvine. Next, we have a very important subgroup, echinocandins, for example, caspofungin, micafungin, and indulafungin. Next, the second broad group, the antimetabolite. We have flucytosine. We just talked a little about it. Third, we have a big group, an important group, the azoles, which includes the imidazoles and the triazoles. The imidazoles, mostly topical, like clotrimazole, miconazole, iconazole, oxyconazole. By the way, don't confuse clotrimazole with cotrimoxazole. Cotrimoxazole you had read in bacterial diseases, which is combination of two drugs used for bacterial infections. Here, this is clo and trimazole. So, clotrimazole is an antifungal drug. So, these clotrimazole, miconazole, iconazole, oxyconazole, these are topical drugs where ketoconazole was used systemically, but now we have better and safer drugs, the triazoles like fluconazole, voriconazole, itraconazole, posaconazole. Next, the broad group is the allylamine. The allylamines include terbinafine, which can be used topically as well as systemically, and we also have others like naftifine, which is used topically. And we have miscellaneous other drugs which are mostly used topically. Now, first, let's go to amphotericin B, the famous drug now. Now, amphotericin B is cidal. That means it kills the fungal cells. So this is a good advantage. In contrast, there are many antifungal drugs which are static. So this is a good advantage that it kills the fungal cells. Second good advantage that it has wide spectrum. That means it can kill different types of fungi. So this is also a very important advantage. But it is used only for serious fungal infections. So why only for serious fungal infections? Because it is toxic. Another disadvantage is that it is not effective orally. Now, in this group polyenes, we have nystatin, hamycin, but these drugs are much more toxic than amphotericin B, and they are too toxic to be used systemically, so they are used topically only. Now, how does amphotericin B act? In this context, I would like to strongly recommend students to refer to Goodman-Gilman's the pharmacological basis of therapeutics. There is a beautiful diagram and the related text there. So I would strongly recommend you to have a look at that. So let's try to understand it through this picture. If we consider these to be the lipid bilayer of the fungal cell membrane, and these orange bars represent ergosterol. We talked about that ergosterol is a different sterol, so we are going to use it as a target. So what happens when we are using amphotericin B? Traditionally, it was believed that amphotericin B makes pores or channels through this fungal cell membrane, and as there are pores or channels, the inner contents leak out and the fungal cell dies. This has been believed so far, but recently new research has got some new insights into it. Now it is believed that amphotericin B can form aggregates and they can sequester ergosterol from the membranes like a sponge, thereby destabilizing the membrane and ultimately resulting in fungal cell death. Okay. Now, amphotericin B, we discussed it is a toxic drug. To minimize the toxicity of amphotericin B, liposomal amphotericin B has been developed. So, liposomal amphotericin B is not a completely new drug. It is amphotericin B given through a liposome, a new drug delivery system. And liposomal amphotericin B is not only the drug of choice in most of the serious life-threatening fungal invasive fungal infections, it is also drug of choice in conditions like visceral leishmaniasis or kala ajar. So this is a representative diagram of a liposome. You can see this is also a lipid bilayer. Here you have the hydrophilic heads, here also the hydrophilic heads. So the region in between, here you can put your hydrophilic drugs. On the other hand, here you have these hydrophobic tails. So if you want to put some hydrophobic or lipophilic drug, you can put in these regions. Like here, you can see a drug has been placed in the aqueous fluid inside, and here a lipophilic lipid soluble drug has been put inside the bilayer. Now moving on to the next, another big category, that is the flu cytosine. In biochemistry, you have read about nucleic acids, so you know this ATGC cytosine. Here we have flu cytosine, 5-fluorocytosine. This is transported into the susceptible fungal cells by cytosine permease. Now, inside the fungal cell, what happens? Inside the cell, flu cytosine is deaminated to 5-fluorouracil. This 5-fluorouracil is an important antimetabolite which is used in cancer chemotherapy. So this 5-fluorouracil is further converted to 5-fluorouracil ribose monophosphate by uracil phosphoribosyl transferase. Now here you have the monophosphate, which can be converted to diphosphate and triphosphate, right? Now here you can see this U. ATGC was in DNA. So what we get in RNA, we get U. So here you can guess that this is going to do something wrong with the RNA, right? This is going to inhibit the RNA synthesis. On the other hand, this product can go in a different pathway. It can be metabolized, it can be metabolized to 5-fluoro 2' deoxyuridine 5' monophosphate. And you can see there is deoxy, that means you can guess that it is going to do something wrong with the DNA. Now we know that thymidylate synthase is an important step in the, it catalyzes an important step in the DNA synthesis. And here, this product is going to inhibit the thymidylate synthase, thereby inhibiting DNA synthesis. Now you can think, you can have a doubt why it is causing selective toxicity to the fungus, because we also have DNA and RNA. In fact, this flu cytosine is, it can be converted to its active metabolites only by the susceptible fungal cells, not by our cells. Flu cytosine was actually invented as an anti-cancer drug, but later it was found that not an anti-cancer drug, it is actually an antifungal drug. It has action against the fungus. Now we move on to important groups like agiles and allylamines. Now again our target is ergosterol. The synthesis of ergosterol is from squalene. Squalene is acted upon by squalene epoxidase, which converts it to lanosterol, and lanosterol is acted upon by 14-alpha sterol demethylase, which converts it to ergosterol. Now this ergosterol will be incorporated in the cell membrane. Now if we want to inhibit this ergosterol synthesis, we can either block the first step, that is squalene epoxidase, or we can block the second step, or the 14-alpha sterol demethylase. The first step is blocked by allylamines like terbinafine, naptipine. On the other hand, the second step is blocked by agiles, imidazoles, and triazoles. Now, these agiles, both imidazoles and triazoles, they reduce this ergosterol synthesis by inhibiting fungal cytochrome P450 enzymes. Now, the affinity for the fungal cytochrome P450 enzymes is much more than that for the human enzymes. This confers the selective toxicity. However, this is not the absolute. So, therefore, they can affect the mammalian cytochrome P450 enzymes to some extent as well. And from general pharmacology, we have learned that the cytochrome P450 enzymes are involved in our body also. It is involved in various drug metabolism. Therefore, the agiles are prone to drug interactions. Now, triazoles, in contrast to imidazoles, the triazoles are more selective to the fungal enzymes than the imidazoles. So, the triazoles have less drug interactions and less adverse effects. Okay. Now we move on to echinocandins. So this is an important group of drugs which target the cell wall. We have caspofungin, micafungin, anidulafungin. All of them are used intravenously. Now, how do they work? The cell membrane, sorry, the cell wall, it has the stability of the cell wall is maintained by fibrillar polysaccharides like chitin and beta-1,3 glucan. The glucan synthase complex, it is located in the plasma membrane. The glucan that is synthesized, it gets extruded in the periplasm between the plasma membrane and the cell wall. Now this glucan gets incorporated into the cell wall, and it will be providing stability to the cell wall. What does echinocandins do? They inhibit the activity of glucan synthase complex, and glucan synthase complex catalyzes beta-1,3 glucan synthesis. Therefore, echinocandins inhibit the glucan synthesis. So thereby, ultimately, they affect the cell wall synthesis. And cell wall, as you know, it is not there in our cells, but in the fungal cells, they have cell wall. So these are very well tolerated drugs in comparison to most of the other many of the other antifungals, but these are expensive. Now we move on to glycophalvine. Glycophalvine, it is an orally administered drug, but it is not cidal, it is fungistatic. And how does it act? It inhibits the microtubule function and thereby disrupts the assembly of mitotic spindle. And as you know, that mitotic spindle is an important step necessary for cell division. So glycophalvine affects fungal cell division. Next, we can briefly talk about some topical drugs like cyclopyroxolamine or oxaborole or the tavaborole. Cyclopyroxolamine, it probably causes chelation of trivalent metal cations. Now, there are enzymes, fungal enzymes, which are dependent on these metals. Thereby, if they cause chelation of the trivalent metal cations, thereby these enzymes are inhibited and ultimately it affects the peroxide degradation. The oxaborol, they inhibit leucyl tRNA synthetase, thereby inhibiting fungal protein synthesis and resulting in fungal cell death. Okay. So, in a nutshell, in summary, let's have a look once again. Amphotericin B or the polyenes, they bind to the membrane ergosterol and they affect the membrane function. Glycophalvine, they inhibit microtubule assembly and thereby they block fungal mitosis. Agiles and allylamines both block fungal ergosterol synthesis. Agiles inhibit 14 alpha sterol demethylase, whereas allylamines inhibit squalene epoxidase. Echinocandins, they are very different type of drugs. They affect the fungal cell wall by inhibiting formation of glucans. 5-fluorocytosine, it disrupts fungal RNA and DNA synthesis. Oxaborols like tavaborol, they inhibit fungal amino acyl tRNA synthase, thereby inhibiting fungal protein synthesis. Okay, so I hope this up to this it is clear. So these are the texts that we consulted for this presentation, the references. So mostly Goodman and Gilman's The Pharmacological Basis of Therapeutics, and also the other texts were consulted. Any questions? Any question? Okay. So thank you very much